Well, welcome everybody to the Parental Alienation Awareness Day conference brought to you by Parents Beyond Breakup. We've been running since Father's Day 1999, keeping mums and dads alive and in their kids' lives. Parental alienation can be an emotive topic, and you may hear differing views or experiences today. If you have any strong emotions coming up or want any further one-on-one support, please call us on our helpline. It's open 7 days a week. If you're within Australia, the number is 1300 853 437. Alyse, I'd like to welcome you into the discussion. Do you mind sharing with us your personal experience around surviving parental alienation, and what did you notice amongst the behaviours in your parents? What was the impact on you as a child?
But this is very important to me because I'm an adult child of severe level parental alienation and abduction. And my father, who's on the book covers here, the little top picture is me with my two siblings and my dad and my uncle on the last contact visit that I had with them. And then the second book below it is actually my dad and I. Mm. After we reunited after 23 years apart. And abduction in the middle of that, taken to, a different state under different names. Nobody ever noticed. We went to a lot of schools, 50 schools, and, had a lot of trouble. Nobody ever noticed what was going on. No one ever even questioned it. So, we talked a lot about this at the conference. We've had 16 hours of conversations about this. The adult children are definitely banding together and standing up and talking about this because we're over it, basically. And what a lot of alienating parents don't think about is we actually grow up. And, that's the one thing they have forgotten about. They can argue and fight over and weaponize us as children and stop us from seeing our targeted parents, but we watch everything, we hear everything, and some of us, depending on which category, mild, moderate, or severe level, and severe level with abduction, it's a different world. So it's all I've ever known. I've never, ever had a life without PA. Apart from being an adult child of it, my mother actually repeated the pattern and turned my son against me and tried to use my son to regulate her. So my son didn't talk to me for probably 5 years, and I had to work very hard to get him back. And, the reason why I got him back was because he ended up another girl came in, got pregnant to him. She went over to New Zealand with, the baby. He followed her. He then got accused of the 2 silver bullets himself. So then my son was in the family court system, and that's when I found out about it and I stepped in with him. Ever since then, we talk to each other every single day. I was lucky enough to get him back, after what my mum was doing. But it's a very hard space to live in. For me, it's pretty normal, but it's not just family members who are alienators. I've also my father, who was a dad's distress guy, because when I reunited with him, he told me, he's like, Alyse, do you know about DIDS? And I'm like, yeah. He's like, oh, I've called DIDS so many times. I've just felt so suicidal over what happened with you. And I'm like, "Oh my god, you called Dids? Okay, cool." And then when I spoke to Dids, I was like, "Yeah, I've gotta help. I gotta help out here." It's come full circle. So, yeah, it's very, very tricky. And then my dad married 3 different women, and the 3rd one showed up to be a severe level alienator. And he was in a domestic violence relationship with her for probably the last 20 years, I'd say, before he died in 2021. And I knew he was in very hardcore DV with her. And she was using him as a regulatory object. And then she didn't want us, my siblings or I, to see him. So he would go down the street, he would call me from a like either the payphone or from his car, and he never was allowed to speak to us in the house. So here we were again. I'm reunited with my dad, but I've got another alienator in the picture who's basically a clone of my mother. So I'm like, Dad, you're not picking good people here, mate.
Wow.
So it's pretty hardcore. So I've got alienation coming at me all over the place. But the good news was with my son's ex-girlfriend, I was able to talk to her enough so that because she's a child of alienation herself, and so is her mother. So the intergenerational trauma patterns are rife. Use children to regulate you, have children to regulate you. Like it's the wrong way around. We have children, we regulate them, but in this case, they have children to regulate the adult. It's totally around the wrong way. So instead of doing your work around what your abandonment wounds are and your intergenerational trauma, they're just using us, children, and they keep us in a severe level case, they keep us in a coercive control relationship, which is what Stan was talking about. We are the regulatory object in that house. We do learn very quickly. We've got to keep an eye on them all the time. They're like the sun, and we're like the planets that revolve around them. And if we do not do what they want or we go out too far, the sun rays shine on us and we have to come back in very quickly and regulate them. That pattern does not allow us to ever have autonomy. We're not allowed to have voices. We have to have voices of the alienator in the severe level category because they don't want anyone challenging them or um, going out and seeing our targeted parent. Like, God forbid we actually did that and enjoyed ourselves, or saw my grandmother or grandfather or my uncle who's in this picture. He was equally as affected. I was very surprised when I reunited with my dad. My uncle was crying his eyes out because he'd had such a strong bond with me as a child, and then he never got to see me for the 25 years. But it was great because when we reunited, I also had him in my life as well as my dad, but both my grandparents had passed and my great grandfather had passed, and he was 101. And when he had his 101 birthday in the nursing home, I actually had a son at that point, and we could have gone to his birthday. So it's just a long sort of really serious effect on family members. But I decided, because I've worked in mental health and disabilities for 30 plus years, and then I realized at one point, I got to do something about this. I've got to stop this trauma right here, right now. I got to do whatever I can do. So I went to a lot of schools. I was actually expelled from 3 high schools. I was very distressed and upset and abducted, but I managed to get my act together and started to go to school as a mature age student and worked my way through, um, and then got my doctorate last year. So I've got a twin study doctorate in adult child survivors of severe level parental alienation and what treatments they've experienced, what worked, what didn't, and why. So I captured all that data. And I've got a second study of the mental health practitioners who actually work with adolescent and adult child survivors of severe level. That's the level that I work within. I don't do mild, I don't do moderate, I do severe. And like Stan said, in the severe level, we have a lot of suicide, we have a lot of filicide, we have a lot of familicide, we have a lot of other stuff going on. And I work in frontline. I'm as frontline as you can get. I work in the jail systems, the mental health units, you name it, and the amount of adult children that I come across with divorced parents. And this is something that none of the therapists that I work with or anyone in the mental health units even ask about. It's not even a question. They just want to know, are you addicted to drugs, alcohol? Have you got a, you know, mental health challenge? Let's treat that. Let's not actually look at the core of this stuff. So that's where I sort of jump in. That's my absolute 100% focus.
Alyse, uh, one, I want to say thank you for being so open, but also being a change agent yourself in doing something about this. There's so much lived experience to unpack there. You mentioned abduction, and that raised a lot. There's a lot of chat coming through right now from the people joining us live, either shocked or relating to that. Um, but there was something in there that you said where the the parents that are maybe afflicting these parental alienation behaviors and conditions around their child. You mentioned that the parent is the son and that the children orbit around them. Are you saying that some of these parents may have intergenerational trauma themselves, but are seeking their own emotional needs from the child? Is that what you're
Yes.
saying to us?
Absolutely. So when a child is born, a normal range parent has a child, we feel all of their needs. We look after them. We want them to grow up and have their own voices and be autonomous and go out into the world. We prepare them to go out and be their own people and have their own experiences. And we're there to pick them up if they fall. And then we let them go. That's normal range behavior. Within an alienation space, a lot of the time the parent has the child to fill their own needs. So I'll hear a lot because I work on like as a clinician, I'll hear, "Oh, I'll have a baby and then I'll never be lonely again. And, I'll just have that baby forever and it'll always be with me. And then when I'm older, it can look after me." And I'm like, "Okay, red flag, here we go, sit down. Let's have a conversation," because that's all around the wrong way. But it's very, very hard because the intergenerational trauma, if we go back, and I often will look at what's the background of your parents and your partner's parents, and what have you heard from the grandparents? Is there adoption in there? Is there a parent who's died or a parent who's suicided, or is there war? Like, is a whole lot of factors coming in epigenetically, and we are our ancestors, and a lot of the time it's very interesting. We inherit a lot of their trauma, and it shows up in us. So we've got to be very careful how we act around the children, and how, like, we've got to think to ourselves, what's the best way? What's the best thing for the child here? And a lot of people just don't do that. And then weaponizing the child. When I talk about abduction, I am very, very firm on this. We actually had Dr. Rebecca Bailey speak at our conference. Dr. Rebecca she works with NECMEC, which is the National Center for Missing and Exploited Children in America. And the FBI actually take children to her who have been recovered. So she has a farm. She works with her husband. He's the chef. It's got a whole program. JC Dugard was one of the children who was actually recovered and taken to her. She's got a long history in this space. She spoke because she's an adult child of high conflict divorce as well. So she spoke about that. And she also is of the same opinion as me. Anybody who takes a child from a safe, loving, and emotionally available parent to a place where the parent doesn't know that the child's been moved to, or it's very, very hard for them to get to the child, and then they've got the child all to themselves and they're turning the school against the other parent. This is abduction. I am not mincing words when it comes to this. Somebody who just takes a child, away from the other side of the family and just all for themselves, that's a very serious thing to do. That is not okay. And for children who've grown up in that space, we don't want to be cut off from the other side of our family. We want to be able to say, "Hey, really miss my mom. I really miss my dad. Can I call them?" And we want our other parent to say, "Absolutely. Here, have some privacy. You sit and talk to that other parent. Do you want to go see them?" Not have our phone calls listened in on, or if we do speak to our targeted parent. We're terrified about the repercussion. What's going to happen when we get off the phone to that targeted parent? Are we going to get 100 questions? Are we going to get punished that night? Are we not going to get to go see our friend on the weekend now because they've dysregulated, because we've spoken to our other parent? It's a very difficult place for the child to be sitting in.
Can you describe what is that like for the child? How much does the child take in and how much are they aware of when you mentioned there, I just want to have a phone call with the other parent with some privacy and
Yeah.
not be questioned. All those little micro behaviors, the overt ones, the covert ones. Could you very quickly give us a perspective of what is that like for the child? How much does the child actually take in and is aware of?
If we're bonded with our parent, that's the targeted parent, all of a sudden they're gone. It's if a child has a parent who dies, the whole community comes around them and there's a funeral and there's a wake and everyone, oh my God, I'm so sorry. Your parents died. This is the worst thing that could ever happen to you. This is dreadful. You got all these big, mentors stepping in and I'll look after you, all this stuff. But in an alienation case, when your parent has been removed from your life, you are in grief. The research says we have the same level of grief as an adult, and I can attest to that. Because when I was young and my dad left, I was in huge grief. And then when I reunited with him and he died, interestingly, the grief was the same for me. I was very surprised by that. But so in alienation cases, the parent's gone, but we're just like nobody's there. It's easier if your parent dies because you've got everyone around you who is, all joined together. In alienation cases, the alienator does everything in their power to get alliances against the targeted parent. We have to hear all this all the time. We hear everything. And I will always say, if there's a child in the house, do not have conversations with anybody about your ex if there's a child in the house, because we miss our parents so much. And what we used to do is if there was a phone call or anything, we'd be up, we'd be out of bed, we'd be listening through the walls. Are they talking about my dad? Or am I going to get to see my dad? And we were too terrified to even mention our dad's name. We used to whisper and we used to call him the D word. And between us kids, like we weren't allowed to speak about him. It would dysregulate our alienating parent. It wasn't worth it. We knew exactly how to regulate our parent from very young, which then puts us at risk when we're older of anyone who comes at us who's got a similar personality. We're so good at regulating people, we think it's normal. So we now enter into potentially relationships with other people who are going to coercively control us. So this is where my research showed that there is no treatment protocol. There's no treatment protocol for mental health practitioners who have the adolescents and adult children sitting in front of them in the severe level category. There are practitioners who can manage to work, and there are some great practitioners out there. I interviewed 10 of the world's best practitioners and collected all their data, and they came up with 72 different modalities that they use, and two of them repeated the same modality. The
Wow.
others were all different. So this is why I keep banging on about the need for a treatment protocol. It's the Wild West out there at the moment. There's not enough funding. Adult children have not been researched to the point that it needs to be done. So I piggyback off Amy Baker and other people who've researched, but they did not look at the treatment. That's where I come in. I look at the treatment that we use and what works with these kids. And because I've sat in front of so many psychologists, you have no idea. And a lot of the psychologists aligned with my mother. So if I said anything in session, they would tell her. And then I would get in heaps of trouble, especially if I mentioned my dad. So it's like this cycle, and this is the problem. A lot of the mental health practitioners, the alienating parent will shop around for practitioners who will agree with them and align with them and believe everything they say. So if they do not understand the space of alienation and regulated kids, because we are told what to say when we go into session too. So, and if we say anything, we've got radars like you wouldn't believe. If we think that our alienating parent is even within like a kilometer of the building, we will probably not speak to anyone, because are they going to listen? Are they going to hear? This is not a safe space for us. So we have to get the practitioners trained to learn, because we are taught to be child soldiers in the severe category. We are child soldiers, and we will tell our alienating parent whatever it is you tell us in confidence, especially about our targeted parent. We have no loyalty to you. We live in domestic violence. We have to go home. We're going to get questioned, and to get the light off us, we have to give them something, because we're also getting love bombed. So if we give them information, they'll go easier on us. If we don't, they withhold love from us and other things. It can get very, very serious. But I'm talking
That's
about severe level here.
that's a lot for a young person, whether they're an infant, they're preteen, they're an adolescent, or even an adult child to have to deal with. Alyse, before we wrap up our conversation here, I actually do want to provide some hope. I acknowledge that right now, live, we have got grandparents, we've got mums, we've got dads, and there are adult children in the audience right now that are part of this discussion. A theme of questions that are already running through is there hope?
The key to helping these children is empathy. The alienating parent does not have empathy. They use us to regulate them, and they love bomb us. So if we have anyone else around us, it's empathy and positive, unconditional positive regard. We need to be able to learn how to have a voice in a safe space, and the more psychoeducation people can get about this topic, the better, because we need to start training the mental health professionals and the legal people, and just not trusting that they actually know what they're talking about. Some do, but the majority don't. So we've got to give them literature. We've got to get, and the thing that showed up in my adult survivor cohort, their health literacy is very high, because what they've gone and done is found what works for them and how to heal, and all of these things, and they go to mental health practitioners and they teach them. So it's like all around the wrong way. So we've got to get psychoeducation out to the professionals out here, and the adult children. They're powerful. They're a powerful bunch, and they're smart. And the resilience that we build up from living in these situations is off the charts. So it's a double-edged sword. And when we get older, if we're in front of the right people, we have an amazing future. And the adult child survivors in the book here, the warning children are not weapons on this side, it's got that's full of adult child survivor stories. It's brilliant and amazing. And yeah, we're not taking it anymore.
The chat is going berserk at the moment, Alyse, with both gratitude for you sharing your lived experience, but also what you just said there, that there is hope. We can help children that have been through.